So this one was a young patient. It was trauma. So if you guys are doing this with me, do click on the cloud button because that does actually download the images. And you can see that sort of red sort of line that goes right the way across. And when that line goes all the way across, that's when all the images are downloaded and you can have very smooth sort of scroll through. So I just got to wait a few seconds while that happens. But while that happens, we can see that this is a plain CT head. So the way to know that is if you actually look in this area over here, there's no contrast sitting within there. Okay, that's the basilar artery. None of the arteries look particularly bright. And actually, someone told me, and they're actually right. If you look at the mucosa over here, if they look slightly brighter, then it's a contrast enhanced images. If it looks sort of isodense with everything else, then you're probably not looking at a contrast enhanced study. But this is a non-contrast study. And let's scroll through from the very, very top, go all the way to the bottom, and we'll see what some of you guys think. And please feel free. I mean, some of you have gone for it, which is really good. But yeah, just feel free to sort of throw in your answers. Tell me what you think. I am interested, and it's actually quite useful for me to learn sometimes because sometimes someone spots something I didn't quite see the first time I saw the scan. Right, so we've gone all the way down, all the way down, all the way down. So someone said diffuse cerebral edema. So that's not a bad shout, but they are quite a young person. So quite a young person. And actually, one of the ways that you can try and figure out where they've got diffuse edema is if you come to the vertex and you can see some of the CSS bases, then you're going to be like, okay, I'm not entirely sure that you've got, a global hypoxia style injury. So diffuse axon injury can be really, really difficult to see on a CT scan, but I suspect you probably mean something else. And I'm going to go through that because I think you have probably seen what we're looking at. Okay, so as we come down, there is, can you see the sort of little bit of brightness over here? So what I'll do, I'll zoom in a bit. So hopefully you can see. And can you see, and then what I might do is just window it very, very slightly. There you go. That might help. Can you see there? There is actually a small subdural hematoma sitting on that right side, right? And coming down, coming down, coming down. You can see it going all the way down like so. Not sure there's blood pooled down at the bottom there. But yeah, I think there is definitely a right subdural hematoma on this patient. So we could always say, yeah, okay, we're done now. Perfect. We don't need to look at anything else. But we do need to look a bit further. There's a bit more subdural blood over there. And we know this person's had a bit of trauma. And actually, when you come up to this area here, can you see that? That looks very, very sort of low density with a bit of high density there. And we think, okay, so that's right, sort of the front of the head probably. And coming further down, you can see, yeah, there is a bit more of similar looking appearance over here. And there's a bit of a high density location just sitting within the middle there. So that seems to be kind of on the front of the head. Let's see if we can find any more. And actually down here, it does feel like there's a bit of hyperdensity. There's a tiny bit of hyperdensity similar to what we saw earlier, but I would be a bit careful because there is a bit of artifact. I'll give you that. We'll come down here and the actual temporal lobes look okay, don't they? And actually, no, if you look there, can you see that? There's a little bit of a subdural bleed just lying along the temporal lobe over there. So from this, you can start to infer a few things about the initial injury, right? So it feels like this person must have had like an acceleration deceleration injury, because when you have acceleration deceleration injuries, your head's sort of still moving forwards, your skull kind of stops, but your brain inside keeps moving forwards, and it will hit the frontal lobes, and it will also hit the temporal lobes, right? Because the brain will hit whatever's sitting anterior to it, right? And that's usually where you get something called contusions. And, I guess, diffuse axonal injuries, similar thing, but very, very small. But yeah, you do have hemorrhagic contusions on this patient in the frontal lobes. And you've got what looks like a right subdural hematoma and likely a left subdural hematoma as well. Now, the other thing that I quite like about the platform is that you can actually go into bone windows. And I think on this one, you just press number 3 and you're in bone windows. So we've got traumatic injury. We've got to have a look. We'll see what's going on. So facial bones are quite important because if someone's had an acceleration deceleration injury, maybe they hit their head on the front, maybe there's a fracture of the facial bones. I don't think I can see any facial bone fractures. Do correct me if you can see one, but I can't see any there at all. Nasal bones, they look okay. It doesn't look like they're fractured. The frontal bones look okay as well. And then someone has said it, well done, you picked it up. So if we come down, come down, come down, we'll have to see if we can find it. Yeah, can you see that? So well done, someone's picked it up. So just here, just right there, I'm going to just draw right around there. Can you see that? That is actually a fracture. So you got you can have a suture, right? You can have sutures, and I'll show you what a suture looks like. That's the suture over there. and that's a suture over there. And the way you can know that sutures because they're like jigsaw puzzles, and you've always grown up with them. They've got to know each other, they've got close, and they're going to be like that. But when you get a fracture, that's like an introduction of something new, and that is a very abnormal sort of looking line. And actually, when you see that, you can see there is a fracture that is lying there. You come further down, it's going right along the base of the skull. And it feels like it's kind of going towards maybe the foramen magnum as well. So there is also a skull fracture on this patient. If we go back to brain windows, we're just going to make sure that there is no significant blood in the region of the foramen magnum. There's no crowding of the foramen magnum either. So yeah, so there are a few findings on this. So I think on first glance, when you go through it, you may not entirely see everything so quickly. But actually, when you look at it again now, you can see up there's contusion bleed there, a contusion there, maybe some contusion over here, just there and there. And then you start looking around here, you saw that subdural hematoma on the right. And when you a bit closer look on that temporal lobe, which is a very kind of common area to get bleeds and stuff, I think there could be a small bleed there. And actually, come to think of it, that might be a contusion bleed as well, rather than a subdural that I initially had said. And the reason I say that is because there's a bit of low parenchymal density around there. And by the way, if you don't know this, blood is like an irritant. So if blood contacts the brain, then it's going to start getting edematous, very angry, and then you get sort of vasogenic edema. With a subdural hematoma, there's still like an interface between the blood and the brain, and so therefore you wouldn't really expect like an adjacent hyperdensity or reaction to it. And actually, this one, I do think there could be a bit of a low density around this. I think actually that is going to be a contusion bleed there, and a very, very common area. So temporal lobes, frontal lobes, and subdural bleed, and a fracture on this one. So quite a few findings in this young person. And I know people have said, "Oh, is it a cerebral edema?" This person's very young, all right. And I think one of the ways to do it is just have a look at that skull vertex and see if the CSF spaces there are kind of a softish sign to see whether it's actual edema, so cerebral hypoxic edema, right? So good. A few people have got that, and actually, you guys got that quite quickly, actually.